Hey y'all, I'm Liz,
And I'm Colleen.
and this is Mystic Midlife.
And we are going to kind of go from the last episode that we did on perimenopause and
Mm-hmm.
menopause, menopause,
No.
no, menopause, and talk a little bit more in depth about the medical side of it, the physiological side of it. Obviously, understanding that neither of us are your practitioner, but just questions that like you can ask your doctor when you go in and talk to them or your
Yeah.
nurse practitioner. Um, just had some interesting thoughts on that, how different medical treatment and is for women in general.
Mm-hmm.
From a medication standpoint, from a hormone standpoint. Also, we do want to talk about sexuality with women and physiologically how we're set up for that.
Yeah.
Talk about a bunch of different things neurologically, but we're just at this time going to talk about more things pertaining to perimenopause in the start. This will probably
Yeah.
be a little bit shorter episode too, as well, because we want to make
Yeah.
sure we get in some more uh, succinct episodes moving forward
Yeah.
about certain
Yeah.
topics.
Kind of under that
So
umbrella.
otherwise, us, we'll like,
We'll be
let's
all
take
over the
out in this
place.
direction.
Yeah.
Let's
Yeah.
do that.
Yeah. We're going to do
Sorry.
our best to stay focused on topics at hand.
I make absolutely no promises. That's
None.
all I can say. So from the perimenopause standpoint, the main thing we were talking about this morning
Yeah.
is how this weekend I was talking with a particular doctor that I have contact with, and she was stating how um, hormone replacement therapy is the Wild West right now. It is just, even though we don't realize it, it's the beginning. I mean, and of course, before the Women's Health Initiative in the early 2000s, people were getting hormone replacement
Yeah.
therapy, but it was like ethinyl estradiol, Premarin,
Yeah.
progestins, those kinds of things. And then we had that Women's Health Initiative done, and it was like, no, no
Black
more
box
hormones.
warnings.
Everything is so dangerous. We can't do anything,
Yeah.
Um, and now you have people that are just like, okay, we're going to just stick to a low dose. We're just treating symptoms. You always hear, this woman has hot flashes
See, and I
or
don't even
something
have
like
any.
that. Or this woman has night sweats, or maybe she's having problems sleeping. And so the tendency is, especially still in the medical field, is to train with the lowest amount of hormone that you can do to get rid of the symptoms.
Yeah.
Well, is that optimal? Is that optimizing yourself
Yeah.
moving forward? So definitely want to talk about that with you a little bit, because you're experiencing hormone replacement therapy from a different perspective, because you're not going through menopause yet.
No,
You were still cycling regularly
still
and everything like
cycling.
that.
Yeah.
Um, so what has your experience been? And we should, another thing we need to bring up here, male and female hormone replacement is completely different. Females are so much more
Yes.
nuanced because of the number of different hormones that we're trying to replace. And we're also dealing with a uterus and with a cycle
Well, and then
and with the uteruses need to somehow bleed too as
yeah.
well. So like, even if you have a woman that's gone through menopause and she goes on estrogen replacement, she might start bleeding again, those kinds of things. Whereas
Yeah.
men, it's like they slap a testosterone pellet or a shot in them and boom, they're good.
Yeah. Well, then I think they do usually with men, they also do an additional thing that kind of helps so it doesn't convert into estrogen as quickly from
Yeah.
what
So yeah,
I've heard.
they have medications that are basically keep the testosterone from aromatizing
That's
to
what it is.
estrogen.
Yes.
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 So and they don't usually have to take a lot of it. Like some
No.
guys will take a few doses, very, very small dose,
Yeah. Here and
a
there.
couple times a month.
Yeah.
If they do notice it starting to do that.
But with us, it's totally different. And the other thing that I was going to say too, it is so nuanced from woman to woman, because when you bring in, well, now it's called PMOS instead of PCOS.
Yeah, because that it turns out
it
it's a
is
metabolic disease.
1000% is a metabolic disease, which
Yeah.
I think all of us fucking knew that.
Oh yeah.
We knew that,
Well, yeah.
but
Just based on the symptoms.
literally.
Yeah.
Literally. But so like with PMOS and then endometriosis
Mhm.
and then adenomyosis. Hey, I said it. God,
It might, and
said right.
it may be adenomyosis. I
I
don't know.
know. We don't
It's like
know.
everybody says things differently too, which is
Yeah.
a little bit frustrating.
But, like and that's what that I deal with, and
Mhm.
so it's like, with all of that, there is so much nuance within from woman to woman
Mhm.
versus a woman who doesn't have any of those issues, but is still going through perimenopause or
Mhm.
starting perimenopause or whatever, and so I think that's why the symptomology just ranges so much, and
Oh, yeah.
I will say what I have been very thankful for is starting low
Mhm.
to see how
You react.
how I react to it.
Mhm.
I did just get another pellet at the
Mhm.
beginning of this past week. Thank God. I was dragging ass, which is okay. So also fascinating because I do get my blood tested regularly every like 3 months. A for my ferritin because of the anemia, but then also because I'm on hormone replacement therapy. So that is something that I think is absolutely vital is checking your levels on a regular basis.
Oh, well,
Like if
that's the main part of the problem here is that's why I think it's so much the Wild West is
because
because
that's not
people are getting
happening.
given these medications and then they're getting tested occasionally,
Yeah.
and with women, it's so nuanced.
Yes. Yes.
It's so
And
nuanced.
within the ranges, you have to see, okay, where are you within your cycle? And you
Yes.
have to kind of guesstimate, like, okay, this range, this range, this range. And then, like, sometimes if you're getting your blood tested when you're on your period, it's like there's no range for that. It's just like it's ovulation, luteal, and like,
And
yeah, what
all of your hormones being tested?
that's the other
That's
thing too.
another
You got
thing
to get
too.
all of
It's
them
like
tested.
for instance, like we were just talking about the symptom relief way of treating hormones,
Yeah.
which is probably, especially as we're just starting out with the whole hormone replacement therapy thing, that's probably where most people are going to be starting at.
Yeah.
So they give you a low dose just enough to stop those hot flashes. But are you at a dose that is optimally helping your brain, your muscles, your bones, your heart health, etc.? And so that's kind of where I think this is going to lead over time is like, okay, so are you at an optimal level for a woman that's in menopause? Or are you at an optimal level from a lifetime perspective? Like,
Oh, yeah.
are you at those optimal levels that maybe you were at in your 20s and 30s that are really going to make you feel good and help prevent some of the disease mechanisms from occurring
Yeah.
that are now happening because you're in menopause?
Which also another fascinating thing with that,
Hmm.
like, for those who were on birth control for like,
Hmm.
my hormones were jacked
Yep.
in my 20s and then even the second half of my teens
Hmm.
because of being on birth control.
Yeah.
And so it's like, I'm probably just more so optimal now
Well,
than
you
I
know what
would
I
have been
really wanna
then.
say too to women that are millennials or Gen Z or, whatever the next one coming around the bend
Alpha.
is, Gen Alpha. I always forget because 'cause
Yeah.
I'm old. Um, anyway, I really hope you guys, especially in your 20s, start getting your levels tested
Test
then.
them. Test
So,
them.
and if you're on birth control, still get them tested,
Yeah.
but
It
especially when
will
you're
be
not on
effective.
birth control, get them tested. See what your optimal levels are. That way, when you are older or you are going through perimenopause, you have, like, a baseline to look at
Yes. And something to take in
and discuss with your doctor, like, "Okay, hey, I'm noticing this is trending down. Is there something I should be doing? Is it not something that hormone replacement therapy is gonna help me with, but maybe we can have some other strategies
yeah.
to help keep
Are
these at
my
optimal
minerals
levels?"
off?
Yeah, what so many things that can be off.
Are my micronutrients off?
Yeah.
So
Or are you
about
getting a metabolic disorder that's fucking with your hormones? That kind of
exactly,
thing. Yeah.
exactly. The so when I got before this pellet, I got my blood tested and my testosterone was lower than it had been all the other times for
Because
the
all of a
last
sudden the
year.
pellet was gone and your body was probably not really making it anymore on its own.
Well, it wasn't even that, it's because I've been working out so much more. Because yeah,
Interesting.
and I asked our PA,
Uh-huh.
I was like, is this like a thing? Like if you can you use the testosterone more?"
Interesting.
And she was like, "Yeah." And so that's something because I was like, "Oh, that makes sense." Because I was like, "Why is it lower within the same time frame period?"
Interesting.
And so she bumped me up just a little bit
Okay.
more for this one. But I was like, it makes sense because more muscle mass, you're actually utilizing the
Mhm.
hormones in a different way. then versus previously I was not as consistent.
Yeah, and something that a lot of people don't talk about are the different modes of
Yes.
getting these medications
Yes.
and the different levels of actually absorbing them.
Yes.
Some women, a patch works great for 'em. They're absorbing it, it's
Yeah.
getting to the right places. Some women,
No.
it doesn't seem to. And you really can't it's not really safe to be taking, estrogen from an oral route. Not that it's not safe, I shouldn't say that. That it metabolizes in the liver.
Yeah.
So then you get all
And
of
your liver
those.
is what needs to be clearing the estrogen,
Well,
right?
yeah, yeah, but it's like it gets metabolized into different metabolites in the liver, and so you're not necessarily getting
It too.
to the areas that you need to get it to.
Yeah.
So that's why patches work great. That's why creams work great.
Mhm.
But everybody is different on
It's
how they
different.
absorb that stuff. It has to do with so many different things. It has to do with your skin. It has to do with your fat content. It has to do with your vasculature. It has to do with so many things. And then also now people talking about maybe the oral progesterone being a bit sedating because of the allopregnanolone.
I mean, yeah, it
And
helps you
it's
sleep
not
and
really
stay asleep.
getting the levels of progesterone that you need. So she's right. She's 100% right. It is the Wild West
It is
right
the
now.
Wild West.
And so we're going to perform these experiments on my generation. Oh, sorry. I just totally slammed the heck out of the microphone. Sorry.
Yeah, we're
So
the
we'll
guinea
be testing.
pigs.
I get to be like the guinea pig. You are partially a guinea pig, but
Yeah.
hopefully, I really hope that people start recording their symptoms, recording their dosing, following up with their physicians, their nurse practitioners. They're testing really, really often
Yes.
so that maybe within the next 10 years, they can really come up with some good ways to dose people on a one-on-one individual basis. And then the younger generations, you beautiful Gen Zers out there, when you're going through this,
Yeah, you won't feel like
hopefully
WTF.
it won't be so crazy and scary
Well, I think another thing
and full of
too
side effects.
that has affected us or has caused like the whole I feel okay, so observationally
Mhm,
and like anecdotally, looking at the generations, I feel as if it started with your generation with Gen X as
mhm.
far as you guys were really great as far as like parenting and like focused on
I actually disagree with you on some of that,
oh,
but go
but
ahead.
well, not
No,
what I mean like as far as like
I just had this
the
discussion, by the way, with my mom.
the focus I don't I mean maybe not actual parenting, but as far as like the focus on the kids and still having your career and doing those things and that was the focus. And then with millennials, ours was the boss babe movement and
Mhm,
achievement and success and everything like that. And those two things I think have caused us to disconnect from our bodies a little
mhm,
bit to where we're not as in tune with the symptomology because so
mhm.
much of society has just been like, go, 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 go. Forget about where you're at. All of us burnt the fuck out.
Well, and I think your generation got slammed a lot more as far as being consumers.
Oh,
But that's
absolutely.
because of the social media coming online and all that kind of stuff. And don't get me
Absolutely.
wrong, my generation, we're getting on social media too. We're just,
Yeah.
old school. We're Facebooking it.
but
We're
I
not doing TikTok as much and
that
that kind of
yes.
stuff. But
But I think all of those things have really society has not helped us to foster the relationship with ourselves as much, and that's what a lot of us are returning to,
mhm.
and so I think we've kind of dismissed a lot of our symptomology, and I
Oh
think
yeah.
that's why so many women then later on are finally like, my body is shutting down,"
Mhm.
because we've not been listening to her
Mhm.
and she's been giving us signals
Yep.
for maybe decades and has been like help 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 and it's been like that started as a whisper and is now yelling
Yeah.
and so I think that part of this whole thing as far as being in the wild west and like you were saying recording your symptoms talking about them asking questions becoming more in tune like that's something like
There
I
needs to be large studies done.
large studies, absolutely. They will be very complex. They will
Yeah.
have to be, but even, like, personal studies of, like, "Oh, I noticed my blood test, my testosterone was lower," so then I talked to my PA about, like, "Is this a possibility?
Yeah. Gonna
Should
have
I
to be
go up?"
proactive and advocate for ourselves.
Absolutely.
And that kind of segues into what I was talking to you about earlier, about the fact that none of the medications for mental health,
Oh, all of that.
All of that stuff. Like, really, you didn't see any kind of studies being done on women until what?
Early 2000s.
Early 2000s.
And then it
And then even
wasn't
then, it still hasn't ramped up until the
it
last 10 years at least.
I don't think it was written into law that it was required
Yeah.
for them to study women specifically also until
Yeah. And
2016.
I don't even and some of you guys may disagree with me on this. I don't even necessarily think that misogyny is involved in
No,
that.
I think
I
it's
think it's
laziness.
laziness. It's total laziness.
Yeah.
It comes down to
We're too
women have
complex.
cycles.
Yeah.
There's also the danger of somebody being involved in your study and accidentally getting pregnant.
Yeah.
And then that's going to completely throw everything off in your study. So it was just easier for them
Yeah.
to just do it to men of a
Yeah.
particular age group.
Because the
And they
test
also don't
subject
have as many of the hormonal nuances that we do.
exactly, because the test subject is more,
Day to day, he's staying
yeah,
relatively the
consistent.
same. He's more consistent.
Yeah,
Do they have multiple hormones they're working with? Yeah,
yes,
that's not,
also.
I mean, yes, they have estrogen, LH, FSH. Men utilize those hormones too.
Yeah.
But when it comes to hormone replacement for a man, because they don't have that uterus, have that bleed, etc.,
They're
they just pretty much
yeah,
have a standard level of hormones on a day-to-day basis that they're working with.
it's
So that makes
consistent
it so
every
much
day.
easier to test other medications on them because they've got a much more concentrated baseline
Mhm.
than we do. Whereas our cycle makes us a different person.
Every single week of the month
Yeah.
and every single
Not just
day.
neurologically or emotionally,
No, but
but
physiologically.
physically. Yeah.
Yeah,
Physiologically. Yeah.
yeah,
Yeah. So I'm really, really optimistic
yes.
that more and more studies are going to be done about this and we're going
Well,
to
they're
get
gonna
more and
have
more
to be, we're demanding
information.
it.
Yeah. And that hopefully, because it is the Wild West right now, we're not going to have people having bad results
Mm.
and messing this all up where all of a sudden they're like, okay, nobody gets any hormones anymore.
Oh, God bless America.
God, I hope that doesn't happen. So we definitely need to get on that.
I think there will be riots if that ever does.
Oh,
Because
yeah.
so many women are now on it and feel so much
Finally,
better.
riots.
Right? But like for something that's worth it because don't piss off the women.
Yeah,
Don't
I
piss off the
agree.
women like this.
I agree. It's
Like,
getting that way, isn't it?
yeah, it
Yeah.
is. It is. Because honestly, like, you take away our hormones, you thought we were batshit before.
Yeah. Well, that and
Well, either that or we're gonna be too tired.
we're not. And I've talked to you
We're
about
not.
that.
We're
I've
not.
talked to you about that a bit more too, just
Yeah.
about from the perspective of women in healthcare before. For instance,
Mhm.
most doctors that were trained 20, 30 years ago, et cetera, they have that whole whiny woman syndrome. So even female doctors, I have heard note this,
Yeah,
that
they're
they'd be
trained.
working in the ER and a woman would come in and she's crying. Maybe she's a bit hysterical because she is in agony. And the tendency isn't necessarily to give her something for the pain. Sometimes the tendency is to give her something sedating to
Mm.
shut her up. Or doctors will start making jokes of, oh, she just has whiny woman syndrome. Well, you know what? Most of us, I gave birth to a couple of very large children. I have a very high pain tolerance, but I also had ovarian cysts many times throughout my teens and 20s that were horrifically painful. And you're automatically signed up as being drug seeking
Literally, I was
or
just
that kind of
thinking
thing.
narcotic seeking, yeah.
Narcotic seeking, or they just think you're overdoing it, or you really can't be in that much pain. We can't really see anything on imaging right
Yeah.
now or something like that. Meanwhile, a man comes in with kidney stone
Oh, they shoot him up full of everything.
and he's pumped full of Dilaudid and can't even function at that point. And it's just and what's funny is I've seen men be just as emotional and histrionic when in a lot of pain.
Oh,
Pain
yeah.
sucks. Pain makes you not think correctly. Pain makes you panic.
Yeah.
And so I think we really, really moving forward need to look at women's health from multiple perspectives, from the emergency perspective,
Yeah.
from the our maternal life expectancy and fetal life expectancies are going down in this country in some areas, especially with Black mothers.
Yeah.
So do we need to get to the root of that? Why are those
Yes.
particular things happening? Why are, once again, Black women are treated differently in
Yeah.
the ER, especially from that OB perspective?
Yeah.
Like, There were recently videos that came out where she came in and she's like, "I'm feeling pressure here, I'm feeling pressure here. This is happening now." And she got ignored in the ER and basically gave birth right there in a chair. And that happens to all races.
Yeah.
Stuff like that happens. We really need to understand why certain trends are moving in a certain direction.
I
And is it because of understaffing? Is it because of lack of education in certain areas with our nurses and our doctors and our nurse practitioners? You know,
I
there's
think
a lot of things that's coming into play here.
I think part of it can fall under the patriarchal umbrella of the idea that w in ancient times, women's intuition was viewed as sacred and
Mhm.
was listened to and was valued
Now
and
it's just all this checks going off again.
yes. Yes,
Yeah.
and so I think that that's we've and I feel like from what I have been seeing,
Mhm.
we're coming back to understanding that no one knows their body like a woman knows her body,
Yeah.
ideally.
Mhm.
And we feel things differently. We are literally coded both the way that our brain works, but then also within our DNA structure.
Mhm.
We are coded to feel more
Mhm.
and be more sensing to what's happening around us and picking up the subtle nuances.
Mhm.
And so I think that part of it is that, and then but hopefully that'll get trained out of the medical field maybe as far as
Yeah.
like
I mean,
and finally learning to listen.
trigger warning to some people that might be listening, because if we talk about pregnancy loss or fetal death, most women that experience those
They
things,
already knew it
be
was
it
happening.
they knew what was happening
Yeah,
and they were saying, "Something's not right.
yeah.
I feel like something has changed. I just know something's wrong." "No, no, you're fine. You're fine." No, like, a lot of people know their bodies enough and know what's going on to know something's not right.
Mhm.
So listen to them.
Yeah, yeah. It costs you nothing to
It
listen.
costs you nothing, but that is where we do come into, and speaking as somebody that works in healthcare,
Yes.
our form of healthcare is degrading
Mhm.
nationwide.
Mhm.
Most places are understaffed.
Mhm.
A lot of our providers are seeing patients one stacked right on top of the other,
Which is whack too.
and it's not their fault.
No,
They're just expected that by the companies that
because
have
it's the
taken
com
over, like the private equity companies are taking over things like urgent cares and that kind of stuff.
yes,
And so
and
they're
they
being
want
expected with
results.
less staff to have more results and to get more people through.
Yeah,
And, they got to have a job, they got to feed their families.
yeah.
So they'll put up with stuff oftentimes. So the point is, we need to take a hard look at that. And I'm not saying necessarily go socialized medicine, because I've had some experiences with socialized medicine in the
Oh,
UK
yeah, I don't like
when
it.
I was there. And also, we hear a lot of people. I have friends that are in Canada where the healthcare system there is a nightmare as well.
And they'll
There's
come here
Yeah, and
and
they'll
pay
end
the
up
extra
crossing the
money.
border to come here and pay the extra money. So we have ridiculous, overpriced healthcare here, insurance companies messing up the mix, and other private equity companies and corporations that are messing up staffing
Yeah.
and putting way too much responsibility and stress on our nurses and our physicians.
Mhm.
And so things get dropped, ball gets dropped, things get missed, those kinds of things. And then
'Cause there's only so
in
much
other
capacity.
countries where maybe there's socialized medicine, they're running into some of the same issues: understaffed, overwhelmed, underfunded in some cases, or sometimes they're overfunded, but the money's not getting to where it needs to go.
Yes.
And there's fraud occurring and that kind of stuff. So we gotta come up with something else. And I'm not the genius to do that, but there's got to be somebody, a group of people out there that can figure out a way to do this in a way that people get seen and taken care of
Well, I think that's
correctly,
part of the reason why there's a
especially our
rise.
women and children.
Yes. I think that that's part of the reason there is a rise in private healthcare groups,
Mhm.
um,
Where people aren't paying into insurance anymore, they're paying a subscription.
a subscription, and you have that concierge doctor. I mean,
Mhm.
essentially, like,
But what
we
happens if
see a
you're super
private.
low income? Like, when do you
Then
access?
yeah, how do you access that?
How do you access that?
That yeah, and so I think that that's where, like, there
I
is
see people
still that
dropping their insurance left and right now.
I was so
Or just getting
tempted.
catastrophic coverage and then
Yeah.
putting the money that they would have been putting into insurance every month into
Uh,
either an HSA
yes.
or just a savings account
Yeah.
in general, and then paying for their care cash.
Yeah.
Because cash prices are different at the hospital, and cash prices are
Absolutely.
different at your doctor's office.
Yeah.
That's another thing. Should we just have standardized payments
Across the board.
across the board for different services? There's got to be smarter people than me out there
Yeah.
that can take a look at this.
Yeah.
But
That whole thing is a
our system's not
wildly
working. The other
complex.
systems aren't working.
Yeah.
So what do we do?
Do our very best.
Yeah. And we definitely have an economy right now that's also going downhill at the same time. A lot of people out of work.
Yeah.
So how do we function with that as well?
Yeah. AI definitely cannot fix us.
Yeah. Well, that's another thing. AI is going to be moving into this whole healthcare field too.
Which it already has as far as
It
like
already
making
has.
decisions of whether or not they're going to cover someone, which is absolutely insane to me.
Anybody who's a fan of sci-fi, like I am, if you look at all the movies, like the Aliens movies, Terminator, I don't even know that it was in the Terminator movies, but if you just look at stuff that takes place in the future or even like Blade Runner era type stuff or that kind of thing, everybody's like getting into a special bed and the computer's analyzing you and finding out what's wrong. Star Trek's a great
Yeah.
way to explain this, where they just use their scanner and they're like, "Oh, this is what's wrong with you. Okay, we're going to do this. We're going to push this button." That would all be AI involved medical care.
I literally just saw a thing that they do have scans like that. I don't I
It's
don't
gonna
it's not
happen
it's I don't know
eventually,
if it's
and so, how is that going to affect our physicians, our nurse practitioners,
yeah.
our nurses? You're still gonna need hands-on people,
Yeah, but that is something that could
especially until
see
robotics is something that's available,
I
which
don't
right now, at least, we're not quite there yet.
yeah.
But AI making the decisions and making the diagnoses
Yeah.
is coming up.
Yeah.
It's coming up faster than we have any clue.
Which something like that where it's a full body scan where it can maybe detect something sooner than later
Mhm,
so that you can address the issue before it becomes a massive problem.
mhm.
I'm a fan of
So
that.
maybe from, like, a preventative medicine
Preventative.
standpoint,
Thank you. That
yeah.
was the word that I was looking for. Preventative healthcare, yes, please.
Mhm.
And that is something like I encourage all of my clients, like it would because obviously what it's like. We're having conversations and
Yeah,
things like
having
that.
conversations, but we're not their
Just like
healthcare providers,
yeah, but
so
just having girl chat.
girl talk, yeah.
And that's something that I have so many clients that have like not gotten a blood panel in years. I'm like, what are you doing?
Mhm.
I love you so much. Please do this.
Yeah.
Please go have a full proper blood panel. And I think a lot of people are just scared because they're like, well, what if there is something? And I'm like, yeah, well, what if there's
Or
something that
maybe there's financial concerns.
oh well there's that. There's that.
Yeah,
But if I think almost all of my clients, if not every single one of my clients, does have health insurance. And
yeah.
so it's like,
But maybe they're working full time, they have kids,
yeah,
they're running to all
all
these
of that.
different things, they're taking care of parents that are now elderly, and
Yeah.
it's like the last person that you end up taking care of oftentimes is
Which
yourself.
is the problem,
Yep.
in my personal opinion. And that is where women have suffered the most. And that is where we have then come into chronic disease.
Mhm.
And we've had the full inflammatory autoimmune disease and everything like that because we've been taking care of everyone else except for ourselves.
Mhm.
And so at the place that I am now, I'm like, oh no, 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 my health comes first.
Yeah.
My health comes first. She has to come
Mental
first.
and physical health.
Yes, because
Yeah.
if I can't function, I can't do anything for anyone else.
Yeah, exactly.
So I
Yeah.
think, yeah,
A lot of you guys probably feel like you're carrying the load for a lot of different people,
everyone I've
at
talked
least from
to,
an emotional standpoint.
everyone
Yeah.
I've talked to,
And that's
and it's a
okay because
lot.
some of us excel at that and some of us enjoy that. But on the other hand,
Is
like
it?
you said, if you do not take care of yourself,
Yeah,
everything's gonna fall by the
yeah,
wayside.
yeah. I would love to ask every single woman, please do an inventory of your own self. Think about how much you carry for everyone else. And then I'm curious, do you have PMOS? Do you have endometriosis?
Or
Do you
symptoms
have,
related
or
to them.
symptoms
And have you
related to that?
had it checked out?
Yeah. And then, or also, do you have a gluten intolerance? Do you have any other sort of autoimmune response in your body? Because I guarantee you those two are connected. And that's something that I think just a lot of women, because we carry so much of the emotional burden,
Mhm.
it does it they say the body keeps the score. it then comes through.
Yeah, go online, do your own research, and I'm not
Yes.
talking about being a Google doctor for yourself and going, "Oh, I have this disease, this disease, this disease, and
Yeah.
this disease." You don't know until you've been actually diagnosed with
Diagnosed.
them. But the point is that oftentimes you can find websites, you can find, message boards where people will be talking about the providers that they're seeing in your area
Yes.
that are actually helping them.
Yes.
And you may have to burn through a few
Yeah.
until you get to the person that's really gonna help you out and is listening to you. And you just need to really, really hang on to that.
Yeah.
Um, in my opinion, and this is my personal opinion, going through a telehealth company to do some of these more nuanced things is maybe not the best choice, at least in the beginning until you get things set out straight. You need somebody you can see face to face,
Mhm.
somebody that is going to really monitor your test results,
Mhm. Mhm.
those kinds of things. So keep advocating for yourself, keep pushing, stop accepting no as an answer. If they just say, "Oh, your hormones are fine,"
Or if they just tell you you need to
or
get on birth control.
"Yeah, I'm just gonna put you on the birth control pill." Like I was actually told that a year and a half ago. No,
Multiple
two
of my
years ago.
friends have
Yeah,
had
2
that.
years ago when I went and saw. It was actually a nurse practitioner, so it really surprised me. She was a younger nurse practitioner, but they are still teaching in school that if somebody's having side effects from going through the change, just throw them on the pill. It'll even everything out. And yeah, it might help with some of the symptoms, but long term, is that something that's sustainable?
No.
There are other dangerous factors involved. Do you smoke? Do you have a high blood pressure?
Do
Like,
you sit for long periods of
do you sit
time?
for long periods of time? All sorts of things that synthetic hormones are going to cause an issue with. So,
Yeah.
most importantly, and I guess we'll kind of wrap this up,
Yeah.
advocate for yourself.
Advocate.
Um, keep pushing until you find the right person to help
Absolutely.
take care of you.
Do a personal inventory of yourself. Try and really, like,
Make
through
yourself the focus
yeah,
for a little bit.
for a month. If you're not already doing this, for a month, if you don't already track your cycle, try to track your
There's
cycle.
apps, it makes it so easy,
So easy.
and you can put your symptoms in there too.
Absolutely, I do every month. But just start to be in tune with yourself more and figure out, okay, how am I feeling on this day? How am I feeling on this day? What am I experiencing here? And
Mhm.
that kind of stuff so that you can become more so one with yourself and you can hear her more.
Well, and if we ever get anybody to advocate to do some really good in-depth, huge scale studies,
Yeah.
if you've got all that information in your app,
Oh, it's so helpful. It would be so helpful.
you'd be like, "Oh, here you go.
Yeah. And
Here's everything I've experienced.
yes, also
I've written this down. I've journaled this."
yes. Some of those apps too, like I do Flow, and
Mhm.
with Flow, you can actually do an assessment to figure out if you have PMOS
Mhm.
or other issues because they do
And
have
a
an
lot of
assessment
that'll
on
be
there.
lab-based
Yeah.
because they'll look at your hormones, they'll look
Yes.
at your A1C, they're gonna look at your insulin levels, your
Mhm.
blood glucose, A1C.
Yeah.
They're going to look at multiple factors. So you have to get tested.
Always.
You have to get tested. You have to get looked at. You have to get imaging done in some cases.
Yeah. Yeah.
So just follow up on it and start making yourself the most important person.
Yeah. Because
It's
otherwise,
not selfish.
it's not. Because you
It feels
again, you can't
selfish
you
because all of us
can't
feel
pour,
guilty about
but you
everything.
can't
But
pour from an empty cup.
exactly.
You can't pour from an empty cup.
Exactly.
So yeah.
On that
On
note,
that note,
no, but we're going to talk to you guys in the upcoming episodes, probably a bit more about women's sexuality
yes.
and about some of the
Important.
things that affect our particular generations, pleasure, how different we are from men as far as the chemicals that run those pleasure
Yep.
centers, that ground us, that keep us feeling good. So we'll be talking with you guys again pretty soon.
It's all about the girly pops.
Yes, it's all about the girls. So we'll talk to you guys again soon, and we'll get into more woo woo stuff eventually too.
Yes, also,
I can't go.
always.
I do the woo,
We
so
we love the woo.
we love the woo.
Yes.
So I'll talk to you guys in a bit.
Bye.
Later.